it's about prevention, or it's about making it as the least amount of invasive for patients to undergo these procedures and stay healthy and stay home.
Let's go!
Hey, Joris.
Hello, Nick.
Joris, being at developing medical devices, we often think about developing medical devices to treat patients, right? Mm-hmm. But I wonder, about keeping people away from the treatment, keeping people out of therapy. I wonder if we can talk for a few moments about prevention of going into the hospital.
I think it's a fantastic aspect of medical devices.
Right.
Probably not, it doesn't get enough of attention.
Sure.
Because one of the trends that we see in medical devices is that we want to keep people out of the hospital. Right. So prevention is a huge element of medical devices. And I actually have 3 examples of where I believe innovation is at play to keep people healthier for longer and outside the hospital. And often has to do with screening. So one of those things is mammographies.
Sure, right.
People at a certain age, or women at a certain age, are at risk of developing breast cancer, so have to go through screening. And how can we make that better? Unfortunately, it's still somewhat invasive. People have to go into the hospital. Sure. But with the use of AI technology, just recently, even only last month, in The Lancet, an article was published where we see that with the use of AI, we can detect 30% more breast cancers earlier on. Wow. So that's fantastic news. People will go in and have that much more of a chance to have for early detection. And when this kind of stuff is detected early, there is a much higher chance of actually curing people from that kind of stuff. So that's one example. So AI is a big factor there. Sure. Another example is HPV screening.
Amazing.
HPV virus can lead to cervical cancer down the road. So people are getting screened for that, and it is again a relatively invasive procedure. So because it requires a swab from your vagina. So with self-sampling kits, all of this is going to be made easier, so people can do that at home, send in their sample, and all of that kind of stuff helps people to detect earlier a disease stage for cervical cancer, and again prevent the disease from becoming real bad. Yeah. And a final example here that I want to highlight is colonoscopy. And colonoscopy is, again, at a certain age, you're being asked to come into the hospital for the procedure to look into your colon system to see if you have any.
Never very pleasant.
Never pleasant, exactly. So we have spoken before about a pill that you can take.
Capsule endoscopy.
The capsule. Yeah. So in this case, the pill can also be, and contain a camera to do the whole, basically track the whole system. So that's definitely not standard practice today.
Nope.
But I mean, it's coming, and there's a lot of innovation in that space. And then I also want to speak about, if we are detecting something that is suspicious in the colon and needs to be removed. In the past, you would often have to undergo relatively invasive surgery, but these days they can take out a polyp with an endoscope, and actually relatively large polyp. So way more procedures can take place in a less invasive methodology. So that allows people to come into the hospital and basically leave the same day. So again, it's about prevention, or it's about making it as the least amount of invasive for patients to undergo these procedures and stay healthy and stay home.
Yeah, I guess just easier monitoring and then quicker turnaround on treatment.
Absolutely, that's exactly it.
Amazing.
So there's a couple of examples where you see that in play.
Awesome. Well, thanks very much.
Thanks.
Have a great day.
Have a great day.